So currently we have two different guidelines, basically coming from two different societies. One of them is ESHRE, European Society, and the other one is the ASRM, the American Society of Human Reproduction. Both of them emphasize the importance of a lack of knowledge we have in our field regarding the COVID-19. Both of them say, look, embryo transfer should be avoided. And both of them state that because we have a lack of knowledge, it would be recommended also not to initiate a stimulation and also not putting back an embryo. Now, unfortunately, we have a lack of information because we don't know the risk of an unborn child, especially in the first trimester if you would get pregnant. The question is this the right time for ovarian stimulation? Now, because we have a lack of knowledge, we would indeed recommend, if possible, to postpone the stimulation for the next few weeks until this peak has passed. But obviously, you will always be exposed, even if this peak has passed, the virus will not disappear completely. If this virus is not there, there will always be other viruses or other bacteria around, which can always have an impact on an unborn child. But specifically now that we are dealing with an increasing number, especially in the Middle East, in Europe, in the States, it's upcoming. Now the next question is, if let's say you are a poor responder because of your age and you don't want to waste time, and you say, look, I want to do everything which is feasible to get the oocytes I have because I don't have much time to wait, and you go ahead, obviously in discussion with your clinic and with the physician. And what would you if there is a lockdown? Now there are criteria to be allowed to visit a clinic. Obviously there are life-threatening situation, non-life-threatening situation, and it's up to you, to decide what it is. Obviously this is not a life-threatening situation. On the other side, you don't want to waste time. So obviously if you're undergoing a treatment, you're under a stimulation, I think this is a valid reason to be seen with the clinic and with the physician in order to go ahead. And currently in the UAE, the lockdown is in 8 p.m. to 6 a.m. in the morning. And during the days, people are going to work, people are going to the pharmacies, to the clinics, to the hospitals. So I don't think that would be an issue currently. Who knows how things are going to develop in future, but currently this is absolutely not an issue at all. Now the next question, which is frequently asked, is if you have been scheduled for an embryo transfer, is it recommended to go ahead for an embryo transfer? Now I think this is a very important point. Imagine you have undergone your ovarian stimulation, you have your oocytes, the embryos have been created, and you plan to undergo an embryo transfer. We have almost no information on the risk of transmission in the beginning of a pregnancy, meaning if you undergo an embryo transfer and the mother would be positive or what got infected, what would be the impact on the baby. Very important to know that in the first trimester, in the beginning of a pregnancy, you have the most crucial and the most important part of a pregnancy, because this is the part where the organogenesis is being created, the brain is being developed, all the organs are being developed. And you don't want to have anything which might interfere with that part. So the recommendation would be indeed not to go ahead with an embryo transfer and postpone that until the peak has passed and the prevalence of COVID-19 went down. So clearly to answer, should you go ahead with a transfer, our recommendation would be indeed absolutely no. I would postpone an embryo transfer currently. Now the question is, okay, imagine we are postponing a transfer. How long should that transfer be postponed? Is it harmful for the embryo to be cryopreserved, to be frozen for a long time? I think it's important to know if you vitrify, if you freeze an embryo for, let's say, 1 second, or 1 year or 10 years, that doesn't make a difference. So being annoyed that you are losing time while your embryos have been cryopreserved or frozen, I don't think that's an issue. So no issue at all if you are postponing your embryo transfer for a few weeks or even few months until this peak is over. I would not be worried about that. Important is to generate those embryos. Once you have these embryos, they don't age. If you keep them in a vitrified medium, they stay there where they are. it doesn't matter if you keep them 1 week or 1 month or 2 months longer. So this is why once the embryos have been generated, no worries at all. The next question is, what is being done to ensure the safe environment for the embryos at the IVI labs? Now, obviously, there are certain criteria prior entering a lab. You need to disinfect yourself. You need to have special clothing, special dressing prior entering the lab. There are particles in the air which we call VOC. So there is a lot of things ongoing prior entering the lab. So the lab, this is the part where I would not be worried about the risk of transmission. I think the risk of transmission would be rather in the clinical part, where patients are coming to perform a blood test, where patients are coming to do an ultrasound scan, where patients are interacting with the medical and non-medical staff in the clinic. So in order to reduce that risk, what we have done is we try to dilute the patients. So obviously we have cancelled the embryo transfers. We have cancelled the physical outpatient clinic, so we don't have any contacts with the patients. And we have reduced the number of contacts with the patients, which means that there will be no full waiting area. When a patient is coming, that patient will be mostly alone. So we always try to keep the distance as far as we can. And obviously, everyone is protected when in contact with the patients in order to ensure that we reduce the risk of a possible transmission to a very, very low risk. And obviously, all the clinics are being disinfected, I would say, on daily basis.